Well, good afternoon everyone, and thank you for taking the time to watch and listen today. I said that we would come back together in September to provide an update, and so it's good to be able to speak to you all once again. As has become customary, I will start by handing over to the Minister for Health and Social Care, David Ashford, who will bring you up to date with the latest coronavirus figures. David.
Thank you, Chief Minister. The total number of tests undertaken stands at 10,194. People awaiting results, so the total number of concluded tests is 10,188. The total number of confirmed cases remains at 336, which means we have no new cases identified. I also just want to touch on some of the work that's been undertaken by DHSC over the last month. We've been expanding our microbiological capacity to allow for more testing samples to be processed and also upgrading the equipment required to process those tests. I would like to put on record my thanks to the microbiological team and the people who have supported them for the excellent work they've done. It's not been an easy process for them to go through, and I'm very grateful for the work that they've undertaken to help us here on Ireland. Alongside this, the return to normal for health services has continued, with theatres back up and running and urgent surgery recommencing as a priority. Across all of the services, there has also been work ongoing to reprioritise lists and to bring service capacity back to as close as normal as possible, while still trying to maintain measures in place that should COVID-19 re-emerge on Ireland, things can be readjusted quickly and the department has the capacity to swiftly respond to any new cases should they occur. So I'd just like to put on record my thanks to all of the staff across the Department of Health and Social Care for their continued hard work, not just in keeping our island safe, but also for the work that they're doing in ensuring our services can return to some form of normality. I would equally like to thank you, the public at large, for bearing with us while we work to turn services back on in a safe manner. This has not been without its difficulties, and at times has been and continues to be a difficult balancing act. And we do have a backlog, as I've acknowledged in the past, across the department that does need addressing, but I would like to thank you for your patience while we restarted services in these unprecedented times. Thank you, Chief Minister.
Okay, thanks very much, David. That's great news on the testing side of things. Now, it's been 5 weeks since our last coronavirus briefing, and we are fortunate that the Isle of Man remains free of COVID-19. Along with our friends in Guernsey, we remain the only 2 jurisdictions within the British Isles to have achieved local elimination of the virus. Since the air bridge between the Isle of Man and Guernsey opened, we have welcomed many visitors, including the island's Chief Minister, Gavin St Pierre, who I know very much enjoyed his visit here. And I was lucky enough to be able to reciprocate, making a 3-day visit to Guernsey, where I and many others from the island have received the warmest of welcomes. But despite Guernsey being our only air bridge, the Channel Island was not the be-all and end-all of holiday making this summer. Staycations have surged, with thousands of you taking the opportunity to enjoy a break at home right here in the Isle of Man. It has been fascinating and heartening to hear so many stories of people who have booked into our hotels, gone glamping, or taken out a holiday let and enjoyed what is right and here on our doorstep 365 days a year. We do take our island for granted, don't we? I've heard of people from the south who have gone down north for a long weekend and genuinely felt as though they've had a holiday. This staycation boom has greatly helped our struggling hospitality sector at a difficult time and has ploughed money back into our economy with that all-important multiplier effect. Serving almost as a crescendo to all of this, as the summer draws to a close, was last week's 4-day Super Manx weekend, a series of events to celebrate the return of a sense of normality and to honour our key workers. It got off to the very best of starts when on Friday the Isle of Man reached the milestone of 100 days without any new cases of coronavirus being diagnosed. I've said so before, and I do not hesitate to say so again. This is down to you, the great Manx public. Your efforts to protect our island and our community have made all the difference in our fight against this virus. I would like charities, volunteers and businesses that made the Super Manx weekend such a roaring success. One of the highlights was Saturday's Key Workers Thank You Parade I attended along with Minister Ashford, and I was privileged to have the opportunity to say a few words before the parade was flagged off from the grandstand. The notion of a Key Workers Parade likely conjures images of our emergency services, but this event, like so much of what we have seen and experienced in recent months, served to remind us that key workers are more than our hard-working health and social care professionals, police, fire officers, civil defence and the Coast Guard, people who carried on doing the work day in, day out during a pandemic, so that our children could continue to learn at school, so that we could shop for food and essentials. It's all about the people who kept the lights on and the water running, who emptied our bins, maintained our roads and critical infrastructure, reported the news, kept our financial services running, delivered our mail and parcels, who maintained the flow of freight to the island, people who answered helplines, who processed applications for financial support, and so many, many more. Our island's heroes. It was a poignant moment and one that will last in my memory from my time as your Chief Minister. And whilst many of the weekend's events focused on celebrating and cherishing the best of Manx life, it was also an opportunity to reflect. On Friday, I attended a moving, multi-faith national service of reflection at St George's Church in Douglas, which also recognised the hard work and sacrifices of our key workers. But the service was also to remember the 24 Manx men and women who tragically lost their lives to this virus. We must never forget them. I have spoken in the past about the Manx bubble we have been able to create on our island. A bubble that has enabled us to restore near normality to our lives. I am aware that, on the one hand, there are those who are understandably nervous about any changes in our approach to coronavirus and who are keen to maintain the status quo and protect our bubble. But we must acknowledge that despite the benefits of a sense of normality returning for many, it is not the case for everyone. Hardship and worry arising from coronavirus and our restrictions continue to be felt by some parts of our community and in our economy. Unemployment is significantly higher compared to a year ago, with over 1,100 people registered as unemployed during this July, compared with last July of about 330 people. Whilst our hospitality and leisure businesses have been buoyed by staycations and visitors from Guernsey, many continue to struggle due to our border restrictions, and this is impacting other parts of our economy too. And there are those who wish to, or need to, temporarily leave our island for a multitude of reasons, such as visiting family and loved ones in the United Kingdom after many months apart. Whilst this has been possible now for some time, the 14-day self-isolation upon return means that for some, a trip away is simply not viable, as it would require a further fortnight off work. These pressures mean that there is also a group of people keen to see government exploring other potential options, which will maintain the safety of our community, whilst protecting more freedom and flexibility for those wishing to leave our shores. The job of the Council of Ministers then is to balance the need to protect our island from COVID-19, whilst being mindful that the restrictions we have put in place to achieve this are having an impact on some parts of our community. From the beginning, we have had to judge the balance of risk, but we must also recognise that there are those who are content with where we are now, but also those who are becoming frustrated. You may recall at the last briefing at the end of July, I spoke about the work being undertaken by government to explore the possibility of modifying self-isolation for returning residents. This would involve a test for COVID-19 on the 7th day of self-isolation, and if the result was negative, it would mean that someone could leave their home, but with significant restrictions in place to minimise the risk of any inadvertent spread of the coronavirus in our community in the event of a false negative. Over the summer, we have reviewed and prepared the ground for what we would need to have in place in order to establish this modified self-isolation and testing regime. This morning, the Council of Ministers met to consider the findings of that review, and we were satisfied with the preparations that have been made. I am pleased, therefore, to announce that from this Monday, the 7th of September, we will introduce an option for returning residents to book a test for COVID-19 on or after day 7 of their self-isolation. This approach has worked well in Guernsey, where it has been in operation for several weeks. In that time, no positive cases of coronavirus have been detected following the 7 days of self-isolation. Let me take a moment to explain how the process will work and to emphasise some very important points. A resident who has returned to the island and entered self-isolation will be able to call the 111 service between 8 a.m. and 8 p.m. every day to request a test for COVID-19 to be done on their 7th day of self-isolation. On the 7th day, with a test appointment confirmed, they will then be able to leave their house, where they must travel directly and only to the testing facility at the grandstand at their allotted time. They will then have a swab taken from their throat and nose before returning straight back home to complete their 7th day of self-isolation. The sample will then be taken to the laboratory at Nobles Hospital and tested for COVID-19. The following day, day 8 of self-isolation, the 111 service will contact the resident to give them their test result. As has always been the case, when a result comes back as positive for COVID-19, that individual must continue to self-isolate for a further 14 days, meaning they cannot leave their home. Where a result comes back as negative for COVID-19, that individual will be allowed to leave their home, but they must adhere to a number of restrictions for a further period of 6 days. These will include no attendance at indoor venues such as restaurants, cafes, pubs, gyms, swimming pools, theatres and cinemas. These restrictions will be set out in a modified direction notice issued by the 111 team on confirmation of a negative test result. I must remind you that returning residents are legally obliged to follow the direction notice. In terms of what will be permitted, people will be able to return to their place of work if their employer is happy for them to do so, so long as they do not have a role that requires them to interact with the public, for example, teachers, retail assistants and receptionists. You will also be able to shop, but only for essential items such as food and medicines. Whilst testing for COVID-19 is reliable and robust with a pick-up rate of 90 to 95%, it is not infallible. There can be both false positives and false negatives. The modifications to self-isolation in days 8 to 14 are there to act as a safeguard, a buffer to minimise the risk of the virus spreading in the community in the event of a false negative. If a test result comes back as inconclusive, that individual will have to undergo another test and await the second result. These additional tests will, of course, come at a cost to the public purse. Bearing in mind that people leaving the island will be doing so by choice, there will be a contribution of £50 towards the cost of a test for each returning resident. Those who do not want to pay this fee can, of course, continue to self-isolate for the full 14 days. The contribution will need to be paid by card over the phone when contacting the 111 service to arrange a test. For the safety of staff, payment by cash and cheque will not be possible. I'm conscious that I've given you quite a lot of detail there, and our COVID-19 website, covid19.gov.im, will be updated with full details by tomorrow evening, giving plenty of time over the weekend for people to familiarise themselves with the detail before the new service goes live on Monday. Can I please ask that you do not ring the 111 service to make an appointment before the service launches on Monday, as arrangements and processes are in the final stage of being rolled out. Moving on to borders, The island has been at level 4 of our borders framework for some time now. Despite the announcement I've just made, I know there are many who are waiting for a move to level 3, particularly because it would allow close family members to visit. This morning, the Council of Ministers discussed our border arrangement. We have been clear throughout that our approach to borders will be influenced by coronavirus infection levels in the United Kingdom, our nearest neighbour. We have examined the latest data from the UK's Office of National Statistics, which shows an estimated UK rate of coronavirus infection of around 1 in every 2,000 people over the past 6 weeks. As set out in our borders framework, for a move from level 4 to 3, we would need to see a reduction in the rate of 1 in every 5,000 people. The UK still has a considerable way to go to reach this. The level of cases in the northwest of England and the need for local lockdowns in areas such as Blackburn is also a cause for concern given our close connections and key transport links with the region. As such, the Council of Ministers has decided that we will remain at level 4 of our borders framework for the time being, but we will of course continue to closely monitor the situation in the United Kingdom. Now, I've spoken before about baby steps. With pupils returning to school in the United Kingdom, people returning from summer holidays, and the increasing demand this change in testing will have on our lab and swabbing teams, I do hope you will agree that it is prudent to take this step one at a time over a change. Before returning to the media for questions next week, we'll see children return to the island's primary and secondary schools for the start of the new academic year. And many students in tertiary education will be heading to the United Kingdom, Ireland and further afield to start or continue their studies. And I would now like to invite Minister Allinson to update you on these two topics.
Thank you, Chief Minister. This month is important for all our pupils and students as they restart their educational progress. After an unprecedented disruption to their teaching and the cancellation of exams, I'm delighted that so many of our students received the grades they deserved. Almost all our students have secured places on the courses they wanted at universities in the United Kingdom or at our own university college on the Isle of Man. Government recognised the problems for those returning to their studies in the United Kingdom and have worked with local courier firms to arrange for the transportation of belongings. We've also arranged discounted airline fares through our strategic partner Loganair for those needing to fly to Liverpool, Manchester or London. Many parents want to take their children across and ensure they're settled in for their first year. The Council of Ministers completely understands this, and I hope that the announcement today by the Chief Minister regarding self-isolation arrangements will make the trip easier for all our families. Next Wednesday sees all children return to our schools, some starting for the first time or starting sixth form for the first time. I'd like to thank all the teachers and those other essential staff for getting everything ready for the start of the new academic year. It's a testament to the strength of our community that schools will reopen as normal and we will be having safety for everyone walking through their doors. But to learn and to progress their education, we need all our children back in their classes. For this reason, school attendance is once again compulsory. During the state of emergency, we were reminded about the value of our education service, the strength of our schools and the work of our teachers. Now is the time to ensure that all our children get the education they need. We need to ensure pupils attend school to learn and are allowed to progress. But as a community, we need to support our schools to ensure that if children are ill, they do not go through those doors, to ensure that they are not unnecessarily taken out of schools for holidays, and to employ those universal provisions such as hand washing and good hygiene measures to ensure our schools remain resilient to any future threat. Thank you.
Thank you very much, Alex, and may I wish the very best of luck to those who are starting primary and secondary school next Wednesday, and to all of those who are heading to university, especially for the first time. And now to questions from the media. And first and foremost, I have Tim Glover from Manx Radio. Good afternoon, Tim. Fastyr mie.
It's a while since I've said it. Fastyr mie, Chief Minister. Dealing with the 7 days, have you gone further than Guernsey with the indoor venues? And also, they have a whole list of passive follow-up, as they call it, between days 7 and 14. And I know details are coming on that, but can you confirm that you have to, for example, be very careful about going to nursing homes, to the hospital, and what other measures there are going to be in place?
Absolutely, Tim. You're absolutely correct. We will be closely following. There's no point reinventing the wheel, and if Guernsey have been trialling this for several weeks now and it's been successful, then we will be following a number of the rules and regulations that they've implemented. So yes, we will be asking the people between days 8 and 14 not to go into nursing homes or hospitals unless they have an appointment to specifically be there for themselves, and then that will be monitored. And obviously we are putting all the rules and regulations on our website. It should be there by the end of tomorrow, and for people to double check. And also when they have their test, they will be getting sent a form clearly outlining what they can and cannot do. And we sincerely hope that if people follow these rules and regulations, which the vast majority have been so far, then we will be okay.
And secondly, the moving to level 3, and that obviously is dependent on factors outside of the Isle of Man's control. How concerned are you that, for example, in Scotland, Nicola Sturgeon has said that there are maybe now as high as 1.4. Things maybe plateau, but they certainly aren't levelling out and going down.
No, it is a concern. As I said, for the last few weeks now, the UK have remained about the 1 and 2,000, which when we initially moved from level 5 to 4, we'd said 1 and 2,000 was the area where we would move. But in fact, at the time, they were 1 and 3,900. So whilst we're seeing a much hospital and, thank goodness, a much lower death rate in the United Kingdom, we still are seeing a significant infection rate. Now, obviously, we have to balance the UK data with our own capacity for testing, but also we have to take into account the mental health of our nation, and we have people who haven't seen their children, their mum and dad, their grandparents for quite some time, months and months, and we will have to look at this. And it may well be, if you look at level 3, for example, Tim, it says we may allow people to come onto the island who are friends or close family, and it may well be that the next step will be close family only. But we'll just have to continue to monitor it. Obviously, we've all worked hard to get the island into this position, and I understand the concern and anxiety of members of the public. People like myself who have all our loved ones on the island, it's a lot easier. But if you're living on your own on the island and all your loved ones are in the United Kingdom, then there's an awful lot of stress on those people. And if we can come up with a safe method and it's judged safe for the rest of the population, then that has to be something that we do as soon as possible. But unfortunately, the results in the United Kingdom just don't allow us to do that at this moment in time.
Thank you.
Thank you very much, Tim. Next, we have Sam Turton from Isle of Man newspapers. Good afternoon, Sam. Fastyr mie.
Fastyr mie, Chief Minister. Here we are again.
Yeah.
Well, just a bit, with students going off to university and the potential fear of a second wave eventually, if it does come to the island again, would the government be in a position, or is it planning to be in a position to be able to repatriate students back to the island if it does reach a level where it is deemed necessary?
Well, obviously, that's something is being thought about. You can never say never. I sincerely hope we never get to that situation. I have to declare that my son has already gone back to university and is having to get used to wearing a mask and isolate with his fellow students who are sharing a house. Alex, would you like to take that one, please?
Absolutely, Chief Minister. I mean, I think we're in a very, very different position than we were back in March, when we didn't know that much about the virus, when we didn't have the track and trace system, where we didn't know how to deal with a widespread epidemic that we'd never have to face before. I hope we never have to go back to that sort of lockdown, particularly lockdown of the borders, that we needed to do, which was one of the hardest decisions the Council of Ministers has ever had to make. If we do get a significant outbreak in the United Kingdom or a localised outbreak at universities, we will do our utmost to make sure that those students are kept safe, They may be in localised lockdown and not be able to get out of the United Kingdom. We will make sure that if they need to be repatriated, we do that in the safest way possible, both for them and the Isle of Man population. So I think the fears that we will go back to the way things were when we started this journey, hopefully we can discount. We now know far more, we're now far better prepared, and we can do far more to protect our people wherever they are.
I think it's also worth saying that we've already issued a document to all households on the Isle of Man saying what will happen should we see a reoccurrence of cases, whether that be on the Isle of Man. And obviously looking after our young people who are off studying at the moment is incredibly important, and we will do our utmost to look after their safety. Right, Sam, your next question.
Thank you. Yes, with the air bridge of Guernsey, it's sort of a two-part list, but the first one's just very short of, are we looking at potentially any extension to that later into the year? And secondly, the potential deal with Orkney that was discussed a couple of weeks ago now, do we know where we're at potentially looking forward with that, just with the island's border situation? And we know that airlines are wanting to come back in, but they're not necessarily sure when they'll be able to.
Right, well, first and foremost, I think there are 3 or 4 companies that have tendered for the contract going forward, and we haven't made a decision on that. The Department of Infrastructure Minister will be advising us about that in the near future. So regarding an extension to the air bridge with Guernsey, I suppose I'm more than happy for that to continue whilst we maintain closely aligned, and I know to the end of this month there's no plans for. I was speaking to the Chief Minister of Guernsey yesterday, and they have no plans to change their strategy going forward. It's closely aligned to the Isle of Man. So to the end of the month, yes, if nearer the time, we will have to discuss whether we can keep that going into October, November. It has been incredibly popular, and I know when I was walking around the streets of the capital in Guernsey, I was inundated with Manx residents who'd gone over there and had had a really good time. So it's very popular, and if there's an opportunity to extend it, then of course, Sam, we will. Thank you very much, Sam. We now move on to Rob Pritchard from 3FM. Hi, Rob. Good afternoon. Fastyr mie.
Fastyr mie, Chief Minister. Here we are once more. My first question is just again on the subject of the 7-day system with the self-isolation. How, in terms of this, would involve more freedom of movement for someone who does test negative on that 7th day, and as you say, there are restrictions in place. How are you going to be able to monitor that to make sure that people are sticking to those? Because there is a lot more freedom of movement than if they're just self-isolating and you're getting unscheduled checks, for example.
Well, first and foremost, you'll be breaking the law if you don't follow the rules. You will be sent a list of what you can and cannot do, and if you don't keep to those rules, then you will be liable to prosecution and imprisonment, same as anyone else breaking the COVID rules. There's no change there whatsoever. You'll have seen a number of people who've sadly had to go to prison because they haven't felt obliged to follow the rules, and there's various ways of checking up on people, whether it be members of the public letting us know, whether it be a phone call to the people or the odd spot check. So there are ways. I mean, there's a very, very small number of people who have broken this, and it would be a real pity if anyone thought it clever to break the self-isolation. It's there to not just to protect their loved ones, but other people's loved ones. You may not know that you have the illness, and if you break that and you pass it on to someone who's autoimmune, then you could effectively be causing their death, which I'm sure no one would want in their conscience. And I'm sure that now we're moving to the 7-day, well, effectively 8 days of isolation, then it will be respected, but we will take firm action, and it will be legislation in place to prosecute anyone breaking the rules on the freedoms they are given for the remaining 6 days.
Thank you. My second question for Dr. Allinson. Obviously, after many different twists and turns, students were able to get their A-level and GCSE results a couple of weeks back. There's talks now in the UK that next year's A-levels and GCSEs may be delayed. If that is going to be the case, how will that affect education on Ireland?
At the moment, we're looking quite carefully at the range of exams that are being offered. after the recent controversy over marking, the department have said we will do a full review of the various boards we use. Obviously, at the moment, the House of Commons Education Select Committee are looking into the whole environment and looking into what happened, particularly with Ofqual, and we're waiting for their report. I've already sent a letter to them to highlight the problems we had on the Isle of Man, and hopefully after that report we can then look at the exam landscape. Now, at the moment, the situation in the United Kingdom is quite uncertain in terms of universities and how they will be doing exams, and there has been talk about perhaps postponing A-levels and GCSEs next year, but still a definite commitment to having exams. What we don't know at the moment is when they will be held, and obviously we tend to follow the same boards as used in the United Kingdom, so if the exams are postponed for a little bit later on during the summer to allow some of the students to catch up, do a bit more further work, then we will probably have to follow suit. But we will work with the teaching profession, we will work with the examination boards to get the best we can for our own students. And I think we have to remember that our own students got an extra 5 weeks of education just before the summer holidays, which their UK counterparts lost out on. So again, that's a testament to the strength of our community, but also the strength of our education service on the island.
Thank you very much.
Okay, thanks very much, Rob. We now move on to Josh Stokes from ITV Granada. Oh, we don't have Josh, I'm told. So we now move on to Alex Bell from BBC Isle of Man. Good afternoon, Alex.
Master Mai. I'm just keen to know, now the government has shown willingness to advance its border policy slightly. Many people in the UK and farther afield have come to us. I've heard a lot of talk of frustration that people who don't live on the island can't come over here still to see family or whatever they want to do. So I'm just keen to know, what is the difference in risk between someone who ordinarily lives, say, in the northwest of England, for example, and someone who lives here, who might visit the same place, travel back, self-isolate, and then they're free to go about their business in the community? Do people who live here not have the same chance of bringing the virus back as an off-island visitor?
Well, I suppose people who go off island from the Isle of Man might have only been there for a day or two. They are our locals and our people, and we need to look after them and their safety. People who need to come and visit the Isle of Man, that's increasing the risk. And when you're looking at it from a risk point of view, you need to look at what is acceptable. Allowing your own people to go away and come back and self-isolate is one thing. Allowing people who aren't resident to come over here, ensuring that where do they isolate, the additional numbers that we would then have to monitor and the additional testing just at this moment in time, when you compare that with the risk of the number of cases in the United Kingdom, means that we just don't feel it's possible at this moment in time to move from level 4 to level 3. Now, it's obviously something we want to do, but we don't want to throw away the position that we are in now. It's taken an awful lot of hard work for the people of the Isle of Man to get into a position where life is as normal as possible on the island. But equally, we know that people are suffering by not being able to see their family members. The 7-day quarantine and then that we're introducing will enable people to go away, see their family member, come back and only effectively lose 7 days rather than the 14 that historically they've had to lose, which has stopped quite a few people from going away. But David, I think you want to expand on that.
Yes, if I could just come in, Chief Minister. In relation to that, the risk is twofold. The first is the risk from the area the person's coming from. So it's not an area they're just visiting, but an area they're actually living in. We know from the figures that the UK government has recently published now, the average R rate in the UK is now between 0.9 and 1.1, which means that the risk is growing. But also the second risk is around volume. Obviously, as more and more people move around into and out of the island, and that includes people visiting, then that exponentially increases the risk of someone coming in carrying the infection and something happening to reintroduce community transmission. So the risk is actually twofold, Alex. It's not about saying someone is necessarily more infectious than someone else, but we have to look at the environment they may well be coming from, not just visiting, whereas Manx people are travelling over and, say, going on holiday for a week, but the environment they're living in, and also the risk of numbers coming and moving backwards and forwards across the island.
Yeah, I mean, I understand Alex, the concerns of some people not to be able to have a loved one coming to visit on the Isle of Man, whether it's a new grandchild or etc. But at the end of the day, we have to ensure that the safety of our people, and we don't want to throw away. The last thing I want to do is to have to shut businesses down, shut shops down, pubs, clubs, because we've got a spike on the island. So it's incredibly hard getting that balance right. Yes, we want to enable people to see their family and loved ones, but equally we've got to protect the public. And if we had been able to move from level 4 to level 3 to allow people and friends into the Isle of Man, then of course we would have jumped at that opportunity. But we agreed that it now wasn't the right time given the infection rate. But it's not something we take lightly, but we feel that we had no option. But it was a tough decision.
Just to expand on that, you talk about the R rate, the infection rate, as a determinant of risk. Surely any island resident who visits any of these places where we're allowed to go, after all, myself or you or I are allowed to go anywhere in the world effectively and then travel back, we are then subject to the same risk as anyone who lives there, no? And if you talk about people from off island not having a place to self-isolate or keeping tabs on those people when they visit here, that's a matter of resources, not risk.
Well, it is, but you've also got the risk, Alex, of additional people coming to the island. So we've got a population of 85,000 people, but if you have an extra 1,000 people coming in from the UK, from, if it's from the northwest of the United Kingdom, sadly one of the most infected areas of the United Kingdom, then that is bringing an additional group of people onto the island who may well, sadly, have the illness, and it is down to risk. So it's additional capacity of those people coming over here. It's a hard choice that we've got to make, but based on the advice from our public health and our medics, it's a situation that we have to impose, I'm afraid. But it's also one of the reasons why we're 106 days without a case.
Well, thank you. Thank you very much.
And did you have a second question, Alex?
I suppose that was it, really.
That was it, yeah.
Yeah, okay. Thank you.
Okay, and last but not least, we have Chris Kay from Energy FM. Good afternoon, Chris. Faster my.
Good afternoon, Chief Minister. Why, when we have a facility that can conduct 200 tests per day, are you making people pay £50 for a test after 7 days? Surely you don't actually want people to have to be confined to barracks for 14 days if they've not got the virus. And with this charge, you're surely punishing the poor in society.
Well, no, there's a lot of cost that the taxpayer is having to have and spend as a result of COVID-19. The government is spending tens of millions of pounds supporting business, supporting individuals whose businesses maybe are struggling, whether it be hospitality, etc. And it's your choice. If you wish to go off the island, that's your decision. It's not one we forced on you. If you decide to go off the island, then you are costing the taxpayer the cost of a test. So we thought the fairest way was to, we're not wanting to charge more than it's costing us to provide the test, but we felt the fairest way was that if you want the test, then yes, you can have it, but you cover the cost to the taxpayers. It's not government's money, this is taxpayers' money. We're spending well over £1 million plus in our testing regimes, and to add maybe an extra 600 plus tests a week and maybe greater depending on the uptake, I think is unfair on those residents who aren't leaving the island. So it's trying to be pragmatic. If you analyse the UK, there's talk about how are they going to raise the money to cover the black hole in the UK's finances, and if we keep on throwing away taxpayers' money on everything at this moment in time, then we're going to struggle on where we're going to find that money. So if you choose to go away, that's great, but you're incurring a cost to the taxpayer, and I think it's only fair that you pay the cost of recovery off the test of £50. Now, if you don't want to do that, you don't have to. We're not saying you must be tested. You then wait the 14 days, which everyone else has been doing. This is just an opportunity for those who don't want to wait the 14 days in quarantine to have the test.
For those that don't have a test then and elect to self-isolate for 2 weeks, will you be revising the rules at all for them, such as allowing them an hour's exercise a day like they were allowed during the height of lockdown?
No, it's business as usual. No change to the 14 days. You just carry on as normal, really. So it's purely if you wish to be able to move around and get back to work, if you comply with the rules and regulations, then you've got the opportunity to have that test. A number of people are very supportive of this. It's been popular in Guernsey, where they've had no cases, and we've been spending the month of August building up our testing capacity, buying an extra machine to do the testing in readiness for this. Okay, Chris, now that because we're down a couple of people, I'm happy to take an extra...
My second question is
Yeah.
for the health minister, if I may.
Okay, David.
Good afternoon, Chris.
Good afternoon. The phrase herd immunity was being talked about right at the start of this pandemic in the UK. The government there quickly distanced itself from that phrase. We are seeing a high number of cases over there still, but the death rate is actually very low at the moment, suggesting there may be some sort of herd immunity which has taken place. Given that you say, and you said before, that it's only a matter of time before we get another case over here, is it a worry at all that so few people on the island have been exposed to COVID-19?
Well, the first thing I'd need to say is to emphasise again what I've emphasised since day one. We need to be very careful about this phrase herd immunity. It's an absolutely marvellous scientific theory, but it's never been properly put to the test in practice. There is even debates among scientists as to what level you need to reach for herd immunity, be it 40%, 60% or even 80% of the population. And I certainly don't think the COVID-19 pandemic is the occasion to put it to the test. But equally, we need to be very careful about looking at the death rate and saying, well, actually, things are getting better or COVID-19 isn't as bad as it was, because what you've got to look at in the UK is they have radically ramped up their testing. So if you ramp up your testing, you are more likely to identify asymptomatic cases. And what that means is you're getting more positive results. So it doesn't necessarily mean the death rate has dramatically decreased from where it was. It just means your overall number of cases identified is going up. So we need to be very careful about trying to make this analogy between a death rate going down when the number of tests is going up. And that's what's actually important to focus on.
Also, if I can just point out that herd immunity, you don't keep your immunity forever. Some people who have had the test 2-3 months after having COVID-19 no longer have the antibodies present. I've had the test, I still had it a few weeks ago. I might have lost that immunity now. And there are examples of people getting it potentially a second time. So the herd immunity is something that I'm afraid we have to totally discount now. Because there's only 6 of you today, I'm more than happy to take an extra question from you. So Tim Glover from Manx Radio, would you have got a question for us?
Yes, just flipping Al Bell's question there. We have the Manx economy relies on a lot of people from the UK and further afield coming to work here on the Isle of Man with their family, obviously not here on the island, and they have limited space in their employment to travel over and see family if they wish to. And we've had a few messages in saying they feel trapped and they're now going to have to weigh up whether they want to be with their family or stay on the Isle of Man and be cut off from their family.
Well, I think by moving from 14 days, Tim, for the opportunity to isolate for only 7, you can now take a fortnight's holiday and go away, see your loved ones for a week, come back. Most people can get a fortnight's holiday. It's anything longer which has been the problem. So this will enable people to spend time with family but be able to come back and go back to work. So this should be significant, a way of helping people.
Are you worried, though, that some might make the choice to leave?
Well, I hope they won't take the choice to leave by moving from 14 days or giving them the opportunity to only quarantine for the 7 days now and then get back to work. That will take the pressure off them. Yes, I know some would like it to be 0, but we have to look at the overall safety of our population and look after them. So yes, I would be upset if people felt the need to leave the island, but I can't change the law to allow people to, just because they're threatening to leave, if it means damaging the safety of the island, or the fact that we may have to close down businesses for a period of time because of that. That's why we in the Council of Ministers, we consider all these, the mental health, the health of people, and the financial situation on the island when we're trying to make these decisions. It's a very tough decision that we make. We don't make it lightly, but we do our best based on the latest evidence that we have from our medics and the capacity that we have for testing, Tim.
Thank you.
Thank you. Sam, do you have another question? No. Rob, do you have another question?
Yes, Chief Minister, just one for the Health Minister, please. A bit on the back of the immunity question. Where are we at the moment in terms of antibody testing since that first interim report?
So the first 5,000 have now been completed. We're about to embark on the second 5,000. And then I think, as I said at one of these previous press conferences, we'd then hopefully be able to get a report out for the full report towards the back end of the year. But it's just to follow on from something the Chief Minister just said there. One of the interesting things that is coming out of our antibody study, and certainly the first 5,000 we've done, and we'll see if the same is the same for the next 5,000, that we are finding, like a lot of the world, that the antibodies in mild cases are only sticking around for about 3 months. And there is now cases emerging around the world of what appears to be reinfection with COVID-19. So, you know, we do need to be very, very cautious. It doesn't necessarily appear that an immunity to COVID-19 is for life.
Thank you.
Alex, do you have a third question?
Thank you. Yeah, Viewer's been in touch during the course of the conference here, just asking if any attention will be given to the island of Ireland in regards to the border policy potentially before the UK, if infection rates slow down in Ireland substantially before they do in the UK. Will border policy change?
Yeah, obviously we will look at Ireland and further afield. Who knows, Northern Ireland, or as I say, further afield. Ireland was in a good position. I think most of the outlying places out from Dublin were showing virtually no cases. I know it's peaked a little bit since I last looked at it, but yeah, if Ireland gets itself in a really good position, then that's something that we can certainly look at along with our Guernsey links. But at this moment in time, sadly, Ireland aren't in that position. But yes, we will, of course, look at that. And last but not least, Chris again from Energy FM. Do you have any further question, Chris? Okay, well, thank you for the questions. And as I've said, full details will be available from tomorrow evening. And I promise to continue to keep you updated on any new developments as soon as I can. I remain committed to continuing with these briefings and when we have announcements to make them. That's all for today, folks. So thank you again for your time. Stay safe. Bye-bye.